Hello, everyone. I'm really happy to be here today, and I'm happy to be able to talk with patients directly about the issues facing them, in particular for women in terms of dealing with hormonal balancing, dealing with emotional and mental health needs, and dealing with the experiences of menopause and how that overlaps with cannabis. I think it's really high time that we address these issues for women and move towards better solutions for women managing these concerns. And I'm first and foremost a cannabis patient, but I'm also a cannabis clinician. I'm also an anxiety patient. So, the value of cannabis as an anti-anxiety agent is really crucial to me. I also need it for reproductive purposes. I have a disease called endometriosis, and hormonal balancing becomes a huge part of that for me. And also, I'm getting close to 40, so I'm not that far away from addressing the menopausal issues that should be coming at me. And I really want to reach out to women who are experiencing emotional distress, anxiety, who feel the sensations of their hormone flux and how much that affects their well-being and their daily life and enjoyment and their engagements with others as well. And obviously, as women age, they experience a whole new range of fun times in relation to their reproductive processes and their cycles. And I think we can improve upon what we're experiencing right now and what our options are. And in terms of why you should care about what I'm saying about it, well, I've been in the cannabis industry for 7 years. I've really focused specifically on urgent needs populations. So, for example, HIV/AIDS patients, folks facing cancer, pediatric seizure needs. And now today I'm really here to focus on women. I think they're an under-addressed patient population in the cannabis world. So my hope is that we can move forward for better options for women. And also, I do have a background in the sciences. I have a graduate degree, interdisciplinary science background, and I'm really combining that with the anecdotal reality of engaging with cannabis every day for so long. And frankly, that's the best we can do until we're able to move forward with more research. So I'm hoping that this information will be helpful to y'all. In terms of women's specific needs surrounding hormonal balancing, obviously the arc and the flux of hormones throughout women's lives relate a lot to their emotional health and well-being. It relates a lot to our stress, to our anxiety, to our engagement with others. And it also relates a lot to the aging process, the differences that women experience as they begin to go through menopause. Can really be remedied in a lot of ways by cannabis medications. Women don't have to suffer quite as much and can move forward with wonderful options that mitigate some of the symptoms they're dealing with and help level and balance both their emotions and their hormones. Menopause comes with a lot of components. Irregular periods and then eventually moving away to not having your period whatsoever. But there's also trouble sleeping, mood changes, vaginal dryness. There's a lot of really unpleasant components that go along with going through the change. And I think that women don't need to be experiencing that same level of impact to their lives. So my hope is we can move forward and learn some things about how we can better that experience for women who are aging and for women at all ages who are experiencing that intensity of hormone fluctuation and how that relates to their emotional well-being in their life. And, really, when you think about women's hormones and the balancing, it can relate to any woman. It can relate to women with specific mental health needs like obsessive compulsive disorder or post-traumatic stress disorder, generalized anxiety, panic attacks, and women who are just really experiencing the hormone flux of their cycle, the irritability, the emotional sensitivity that goes along with that, mood swings. All of these components are ones we can address with cannabis, hopefully bring women to a better place of balance in their lives. Traditionally, in terms of the Western approach, what's offered is hormonal treatment, hormone therapy, HRT or menopausal hormone therapy. It's really controversial, and I think it's worth looking at what are the pluses and minuses there. Over-the-counter medications and prescription medications are, of course, also focused on in terms of these issues, and occasionally surgery even. But I think we can look towards this beautiful, wonderful plant for other alternatives. In specific, cannabidiol, CBD, has a wonderful range of properties that directly overlap with women's emotional needs, with women's hormonal balancing, and with the needs of women who are aging and experiencing the change. First and foremost, CBD is non-psychoactive. So especially for patients who don't want to experience the feelings of THC or who need to limit those feelings while they go about their workday, childcare, or any other component, need to maintain focus. And for patients who are new to cannabis, who are very sensitive to THC, you may want to consider the real value of CBD and its applicability to your needs. So what else can CBD do for you besides being non-psychoactive? Well, it's an analgesic, it's a pain-relieving agent, it's an anxiolytic, it's an anti-anxiety agent. So for our purposes here today, that anti-anxiety component is crucial. It's also neuroprotective, it's an addiction-fighting element, it's an antispasmodic, so it can assist with cramping. It can assist really with such an incredible range of needs, and that's why I think we should be really looking at CBD and its applicability to women's emotional and mental health needs, as well as their experience with menopause. It's also an anti-inflammatory. So CBD as an anti-inflammatory is applicable for every patient. It's crucial to bring down inflammation pretty much anywhere we can. But specific to women's needs, of course, there's a tremendous overlap there. I think when we're thinking about new cannabis patients who are looking at CBD as an option, we need to think about what ratios of medication are going to be appropriate. So when I say ratios, you'll see if you go into a dispensary, if you go online to look at medications, you'll see these numbers, 1-to-1 or 4-to-1. These numbers relate directly to what the properties of the medication is likely to feel like for you. So for example, a 1-to-1 medication is equal parts CBD to THC. That tends to be the best analgesic for most patients, but they will experience some level of psychoactivity, some level of high, depending on their tolerance. I think a really wonderful introductory ratio and a terrific ratio for balancing hormones overall is 4-to-1, meaning 4 parts CBD to 1 part THC. That's the zone wherein most patients don't experience any psychoactive effects, if any, maybe minimal amounts if they're very, very sensitive. So it's a really good place to start out, and it may be a good place to stay if your goal is to bring down anxiety, to bring down inflammation, to reduce stress, and to balance your hormones as you go through your life or as you're going through the change as a woman who's experiencing that. The properties of CBD are really affected by how much THC is present. So that 4-to-1 ratio gives you an opportunity to experience a lot of the valuable benefits of CBD without the side effects of psychoactivity or euphoria or lethargy that sometimes are associated with THC. It means you can go about your workday, bring down the stress and anxiety, and keep moving forward. Or for example, if you're a woman going through menopause, you're experiencing hot flashes, you know that you need to still maintain and be able to go through your workday. Ratio like 4-to-1 is a good option for you to be able to maintain focus and bring those hot flashes down and keep yourself feeling level. I think when we're thinking about dosing, especially for new patients, folks who are new to cannabis, we really want to split the difference between what is an acute need focus and what is a longer term focus. So, if someone is experiencing, for example, a hot flash, in the moment it might be of value just to take 1 dose of a medication to address that need. But if your goal is to balance hormones over time, if your goal is to address anxiety or stress longer term, then you might want to consider more frequent and lower dosing. I really am a big proponent of microdosing. The idea of consuming a small amount of medication 2 to 3 times a day may have more benefit for a lot of patients than they realize. And in terms of keeping the medications metabolizing in your system so that you can address hormonal balancing, so that you can address your emotional needs long term, it's really crucial to think about that microdosing and how it might be applicable to your life. Versus, say again, acute need. What if a patient's feeling like they might have a panic attack? That is an acute need moment. You might want to consider a slightly higher dose for that moment than you would if you were doing regular and consistent microdosing. It all depends on your individual needs, and every cannabis patient should approach this topic as an experiment, essentially, as a very safe experiment in which they can learn more about how cannabinoids affect their body and what they can do to improve their health and wellness. I think when we're thinking about stress and anxiety, and when we're thinking about the fluctuation of hormones, it's really worthwhile to consider addressing those needs before they arc up, before they reach a heightened moment. This is also true in pain needs. So essentially, it's a matter of looking at it more as a preventative approach and a long-term management approach than an acute need approach. And I think that's something that is a really wonderful direction for patients to consider in terms of applicability to their lives and the bettering of their functioning. I'm a big proponent also of focusing on terpenes. Terpenes are the aromatic structure of the cannabis plant, and they have a huge value in terms of therapeutic application. In specific, I am really, really deeply interested in beta-caryophyllene. It's something that we put in our medications at Moxie Meds, and I think the reason for that and the betterment of medications is so significant. I urge every patient to look into beta-caryophyllene and terpenes in general. But beta-caryophyllene is the component that comes from not only cannabis, but basil, oregano, hops. A number of plants' essential oils produce this terpene, beta-caryophyllene. And beta-caryophyllene has a lot of amazing properties in its own right. It's an anti-inflammatory. It's an anti-proliferative, meaning it can be considered either a cancer prevention medication or a treatment medication, depending on your perspective. It's also a local anesthetic. It's really a wonderful constituent to consider in terms of its overlap with CBD-rich medications, because it's also a CB2 agonist. What this really means is that it has a value. It brings greater benefit to your system to have beta-caryophyllene along with your CBD-rich medications, because it binds that CBD to your receptor sites. So you've probably learned, or hopefully learned by now, that we have an endocannabinoid receptor system. And that receptor system is really interested in different areas of your body in different cannabinoids. So for your CB2 receptors, you're particularly focused on CBD. And that is where we're looking at the great benefits of emotional balancing, hormonal balancing, the long-term approach. I think is really the goal. So when we're looking at cannabis, we need to think about what cannabinoids we're using. Do we need to focus on CBD or THC for our individual needs? We need to think about dosing and whether we're focused on acute need or whether we're focused on long-term management. And we need to think about the other components of a medication that you might be consuming. I think for new patients, tinctures are a very terrific idea because you can very, very slowly increase your dose or titrate up. That slow increase of dosing can be wonderfully valuable for patients that are new to cannabis or for folks who are trying to dial in more specifically how their medications can help them. So I really, really hope that this information is helpful to women out there and that we can all together work towards a better experience with our lives and our wellness, and particularly with our emotional health.